Good morning. My name is Dr. Kevin Ford. I'm a member of Omega Psi Phi Fraternity Incorporated Gamma Pi chapter and a member of the Health Initiative Committee. And this is our monthly Health Initiative series webinar. And today's topic is oral health. And we're happy to partner today with the National Dental Association. And we're going to show you just a short video, and then I'll introduce you to our speaker for today.
The National Dental Association was established in 1913. We represent over 10,000 minority oral health professionals in dentistry. The National Dental Association focuses on underserved communities. Our members actually get out in the communities to help those that are not able to really help themselves. We believe oral health is a right and not a privilege. We focus on getting into communities for the underserved to make sure that they are getting the access that they need. Our volunteers include dental students, pre-dental students, hygienists, and assistants that also come out and help. The Health Now program so far has conducted 68 events. We've been in 15 cities and in 3 countries. The event has been very instrumental in getting care to the underserved areas. It's just such a wonderful program just to see individuals smile. They receive their products when they leave, to showing the kids how to brush. We really want to get that message out to make sure that individuals understand that oral health is a part of overall health. With knowing some of the statistics that are out there with our children, that the most common chronic disease for children is dental disease. A smile can make a difference in a child, in a senior, and an adult. So they're really out there trying to help individuals have better quality of life.
Okay, so today's speaker is Brother Dr. Edward Chappell. Brother Chappell, and Dr. Chappell is a graduate of Rutgers University, which is my alma mater. He's also a graduate of Meharry Medical College in 1979, where he received his Doctor of Dental Surgery degree. Dr. Chappell did a general practice residency at Eastman Dental Center and then also the Genesee Hospital, 1980 and 1981, respectively. Dr. Chappell is a fellow of the Academy of General Dentistry and a fellow of the American College of Dentists. He's held several leadership positions in dentistry, notably Robert T. Freeman Dental Society from 1999 to 2000. He was the National Dental Association Speaker of the House of Delegates from 2004 to 2010. And Dr. Chappell was also the president of the National Dental Association in 2013. And he also served as the chairman of the board for the National Dental Association in 2017. Dr. Chappell has received many honors, one being the President Award of the National Dental Association. He's also received the Consumer Research Panel's Top Dentist Award. Dr. Chappell is also a life member of Omega Psi Phi Fraternity Incorporated and a member of a Gamma Pi chapter. And so with further ado, I'd like to introduce our speaker today, Dr. Edward Chappell.
Good morning. It's a pleasure to be here. Thanks, Kev. Appreciate that. So it is Dental Hygiene Month. All right. So that's kind of special. Typically, we kind of deal with oral health in February, which is Dental Health Month itself. But, with this month being Dental Hygiene Month, we want to kind of talk about some of the things that are important to your overall health. and dentistry is one of those things. So let's kind of start with this a little bit. Let's talk about what is hygiene. Well, the definition is conditions or practices that are conducive to maintaining health and preventing disease, especially through cleanliness. So you kind of get an idea that the whole purpose of hygiene is to make sure that your oral cavity, and dental hygiene in particular, that your oral cavity is up to par. And many people kind of neglect it because they don't think of it as being important. And we know that many, many years ago, one of the issues that was going on was that, hey, you got a toothache. Oh, you don't need that tooth, take it out. Or you got a baby tooth. Oh, it's going to fall out anyhow, so let's take that out. So, but that's not really what dentistry is about, especially now. Nowadays, it's about maintaining your dentition for as long as possible. So there's no reason why you can't keep your teeth until you get to be 100, if you can make it that far. So your mouth is basically the gateway to the rest of your body. Not only does food, water, and other sustenance come in, but so does bacteria. Your gums are harbingers of all sorts of bacteria that are not affected by the acid in your stomach. So by not being able to clean your mouth appropriately, you are kind of setting yourself up for some of the other issues that can occur. They have found bacteria in the mouth that is associated with failure of prosthetic joints, associated with cardiovascular disease, a number of other kinds of things that bacteria, in your mouth is associated with. Routine cleaning at night, and if possible after meals, can help the gums keep those germs at bay. The most important time is to brush your teeth before you go to bed and to take care of your teeth before you go to bed. I usually tell my patients, reason that is important, if you ever notice when you have a cold or you don't feel well, when do you feel the worst? It's usually at night. After a good night's sleep, you wake up, you start to feel a little bit better. So taking care of trying to get rid of those germs as much as possible before you go to bed is extremely important. Brushing, flossing, if you choose to use mouthwash, anything to help reduce that bacterial level. Next, we want to talk about periodontal disease. Periodontal disease is an inflammatory disease that affects the soft tissue, which are the gums, and the hard tissue, which is the bone. And those are the things that hold your teeth in place. Soft plaque is a place for bacteria to live, and hard tartar, which is plaque that's been on your teeth longer than 24 hours and has gotten hard, creates a rough surface where it's easier for more plaque to attach. Routine brushing with a soft bristle brush and regular flossing can help keep periodontal disease away. However, once you have periodontal disease, which basically represents loss of bone, it will never come back, and there's no way to bring it back. However, what we can do is we can arrest the disease to the point where it's not going to get to the point where you're going to lose your teeth. And that's the whole purpose of it. Regular checkups can help you to avoid that. We have many different ways within our offices to be able to check for periodontal disease, through x-rays, through probing, and there are some tests that can be done. There are some saliva tests that can also be done. So why is this important? Number one, let's talk about quality of life. No one likes pain. Everybody needs to eat. Some enjoy it more than others, but eating tasty food is definitely a pleasure. Being able to smile without shame or embarrassment is also important to most people. Think about those who are uncomfortable about the way they speak or uncomfortable about their teeth and don't want to smile. Think about how that affects them when they go out to look for a job or they're on the job and they have to meet people and they want to cover their mouths. Obviously, the pandemic has kind of kind of fed into this a little bit because everybody's wearing a mask. But, most people feel uncomfortable if they can't smile appropriately. Regular checkups with your dentist can help you avoid many problems or at least address them early in the game. The earlier things are dealt with, the less painful and the less expensive is the treatment. Dental health is 80% of what you, the patient, can do, and 20% of what we, the dentist, can do. And I want to emphasize that because we can clean it up, we can get everything straight, but if you can't maintain it, it's not going to last and it's not going to work. Everybody thinks dentistry is so expensive. Relatively speaking, consider it to be an investment in your own health. Many advancements have come over the last 50 years or so to help with dentistry. Use of topical anesthesia or lasers to help with pain, tooth-colored filling materials, zirconia and other high-strength aesthetic materials, perfecting of implants and how they are placed, and clear aligners to help straighten your teeth. And finally, three-dimensional radiography to help in the diagnosis. Remember, there's nothing better than your natural teeth. They were meant to last for a lifetime with proper care. So as we also talk about dental hygiene, we also want to talk about some of the diseases and processes that go on that can also affect you overall. One of those things is oral cancer. And this is something that actually a very good friend of mine actually developed oral cancer. Fortunately, he was able to survive it, but it took him through some changes. There's no doubt about it. Oral cancer is 10 times more prevalent than women's cervical disease. It can be a silent killer, but like a lot of things, you can't ignore it and use the phrase, maybe it'll go away. At each checkup exam by your dentist, a screening should be done and checking for any red or white spots that don't belong there, and also checking for any lumps or bumps that you shouldn't see. The human papillomavirus, which has had much more airplay over the last 10 to 15 years. I know everybody's been concerned hearing about that and talking about the vaccines and, in this era of people not wanting to be vaccinated and things like that. HPV has been implicated as one of the major causes of oral cancer. If you have that virus in your body, it's always in your virus. And you have other factors such as smoking, heavy alcohol use, smokeless tobacco, you're at a higher risk for developing oral cancer. Oral cancer can be seen on the tongue, on the cheek, actually on the gums, in the throat, any number of places. So it's very important to make sure that you're routinely being checked to make sure that everything's cool. Oral cancer, should be treated early on. And if it's not, or you have to go through that, it's life-changing, from not being able to taste your food to significant disfigurement. Finally, let's talk about sleep apnea, which more and more people are being diagnosed with at this particular point in time. For those who are not aware, sleep apnea affects roughly 18 million adults and is shown to affect about 2 to 3% of the children here in the United States. Sleep apnea is when you stop breathing while you're sleeping. The body has a number of mechanisms to awaken you, but that means you're not getting a restful sleep. Lack of restful sleep can lead to other issues such as hypertension, obesity, diabetes, and cardiovascular disease. Treatment can involve things such as a CPAP machine, which a lot of people say makes you look like Hannibal Lecter. You've got this mask over your face. If you've ever seen anybody with one, it can be kind of scary, but the fact that they can live and breathe is, I think, a little bit more important. Doesn't do much for your love life though. A dental device to advance the jaw, which is become more and more helpful. Basically, the issue with sleep apnea, and one of the causes of sleep apnea, is the fact that your airway closes up. And if your airway closes up, you can't breathe. So your body wakes you up so that you can take a breath. So the CPAP machine actually forces positive oxygen into your lungs so that you are continuing to breathe. So it kind of goes through your nose, it will go in through your throat, what have you, but it is positive pressure. The dental device is a jaw advancement device. What it does is it actually fits on your upper and lower teeth and causes your lower jaw to come forward. By doing that, to a certain degree, it pulls the tongue forward so your tongue no longer can block your airway. One of the other ways to take care of it is also a surgical procedure, which is to remove part of the palate, scrape it away, or remove your tonsils, adenoids, anything that tends to reduce your airway, where your tongue can fall back and block. They try and correct that surgically. One of the things, I have a good friend of mine who lives in Savannah, who's actually written a book about it. And he talks about sleep apnea in children, which is basically not well recognized. And a lot of times pediatricians don't even think about it. As he put it, children shouldn't snore. If they do snore, you really have to pay attention to that. Sleep apnea may be affecting them. So how does that affect the child? If you are a 5-year-old, 6-year-old, 7-year-old, and you're not getting enough sleep, what happens? Most of the time they're fidgety, they're moving around, they can be unruly. And sometimes it's just because they're not getting an adequate amount of sleep at night. And that is caused by sleep apnea. So you really need to, if you have children or grandchildren, you really need to kind of pay attention and make sure that's okay. Because these are the children also that are sometimes diagnosed with ADD or ADHD and end up on medication because it's misdiagnosed, because nobody's paying attention or they don't recognize it. So I think what we've done here is just to kind of touch on some things. I know hopefully there'll be some questions in terms of some of the things that we do, but the bottom line is quality of life. Poor dental hygiene, poor dental health affects your quality of life. So there are 3 things, okay, that we can talk about in dental health. And if you have any questions about any of these things, feel free to ask any questions. So thank you for allowing me to do this presentation this morning.
All right. Thank you, Dr. Chappell. I just had a couple questions. You mentioned acid in affecting the teeth, and we know a lot of people have acid reflux. You see that that's being a big part in dental caries and so forth.
Yeah, actually, people who have GERD or acid reflux, and a lot of people just think of it as I've got a little indigestion or heartburn. The acids that come from your stomach can really do a lot to soften your teeth. So if you kind of get into how does acid work, acid basically softens the enamel, which allows the enamel to dissolve. A cavity is caused by the acid producing bacteria that live in your mouth. They soften that enamel. Your saliva tends to put those minerals back into your teeth. However, if it's overwhelmed by too much acid, it doesn't. That area then becomes more porous and then starts to flake off, chip off, and literally becomes a cavity, which is a hole in your tooth. So you see that people who have acid reflux, particularly behind their lower front teeth, it's an area where they can see cavities start to form on the back of their lower front teeth. That's an issue. people who grind their teeth, and we really didn't get into that. If you have excess acid, you're going to have excess wear of your teeth, particularly in the back. So that can create tooth loss over a period of time if it's unchecked.
Okay. I guess another, just a little bit more about the dental apparatus for patients that have sleep apnea. And I know I have plenty, I'm a practicing physician, as you well know, and I have plenty of patients who have sleep apnea, and some cannot tolerate the continuous positive airway pressure or CPAP machine. And like you said, so that's another option, sending them to the dentist and just kind of, so you said it helps to manipulate the jaw.
Yeah, in cases that are not, so severe, and I say that because obviously if it's too severe and the airway is too small, some people have an extremely large tongue and you're not going to be able to advance the lower jaw far enough forward in order to open up that airway. A custom made appliance is done, which will help to move the tongue out of the way so that the person can breathe. There have been a few people, well, I shouldn't say a few people, but there, many people who can't tolerate that CPAP can find some relief with that. But it's a case by case situation. And that particular appliance is continuing to be perfected. It's been around probably for the last 20 years or so. And it can be extremely effective and help those, particularly with mild sleep apnea and where their tongue is really the issue. And it can, like I said, it advances the jaw. And we kind of titrate that. We kind of do it a little bit at a time to make sure that we're getting it far enough forward that we're not creating other issues in terms of your joints up here, but far enough to allow you to get to breathe.
Are there any like long-term, for people who have to use this long-term, are there any possible complications that can happen?
Well, we can talk about temporal mandibular joint disorder, which is actually your joints that allow your jaw to move up and down. It can affect that to a certain point, but it's a matter of A, like I said, it's custom fit. B, it has to be adjusted appropriately. And if that's done correctly, you should not have any long-term issues.
Mm-hmm. Okay. I have one question from the viewer here. It says, unfortunately, dental insurance is often looked at as optional. Is there a movement to have dentists included in standard health insurance, or is there another way to address the issue?
Well, this is sort of one of my passionate issues in terms of how we deal with dental insurance. Dental insurance really came about probably in the late 50s, early 60s. And it was meant to actually help people handle some of the dental bills. It wasn't meant as to take care of everything. Part of the problem is that people have dissociated the mouth with the rest of the body. And because of that, they didn't think of it as being particularly important. So as dental insurance came along, it would help people pay for preventive things. It would pay for some fillings and other kinds of procedures, but it wasn't meant to take care of everything. If you think about it at this point in time, going back to, I know when I started in practice, people had $1,000, $1,200, $1,500 max for the year. It's still pretty much the same. Medical insurance is considered to be catastrophic insurance. So in other words, once you hit that minimum threshold in terms of your deductible, medical insurance picks up, any place from 90 to 100% of what's going on, unless it's an elective procedure. Dentistry, insurance companies just don't do that. Like I said, they didn't think it was important. In fact, one of the things that is going on right now, they're talking about trying to include dentistry within Medicare. I know that the ADA, which is the American Dental Association, was opposing that. but anything that helps, is a good thing. But in terms of what can you do in terms of insurance, number one, insurances are there to help. All right. So don't let the insurance company, one, dictate what you can and what you cannot have done, or what you should or you should not have done, which is something we run into all the time. I know this is kind of a roundabout answer, but if you think about it, insurance is a help, and it will take care of your preventive things. So the object is to utilize it, go in early, and if you have an issue with your insurance, talk to your employer. They're the ones that choose the plan that you have, and they can, do something about that. Insurance company will pay for anything that you're willing to pay a high enough premium for. So if you pay a high enough premium, they'll cover everything, but most of us aren't willing to do that.
That's true. That's true. And also being an employer, it's very difficult sometimes to cover everything, for your employees. And, we try to cover most of the actual health insurance, but it's a difficult situation because there is a price point on all that. So I think that was a great question that we just had. Another question here. Okay, let's see. I think you may have talked about this. Can you talk about the problems that can arise from not getting caps after root canals?
Well, think of it this way. Teeth are vital, and vital teeth are somewhat, I won't say elastic, but are somewhat flexible. Just like everything else, your bones are flexible to a point. If you overstress it, it will break. Think of your teeth sort of like being a tree. If the tree is alive, it'll bend, it'll flex. Once that tree dies, it becomes brittle. When you remove the nerve from the tooth basically is non-vital. So over time, it will become brittle. So that's why it's important to, number one, have a permanent filling placed on the tooth. And then number two, to have a cap or a crown placed on the tooth to protect it. If you don't, you run the risk of that tooth fracturing. And if it fractures in a way that it can no longer be repaired, all the money you spent, or potentially any of the discomfort you may have had going through the root canal, goes out the window, and you end up losing the tooth. So, and there's a finite window. Some people get away with it for a long time, but that's, more the exception than the rule. So you consider if you've had a root canal on a tooth, particularly if the tooth was badly broken down to start with, you definitely need to get one within the next month or so after you've had the root canal. If you wait much longer than that, you do run the risk of a catastrophic break. If the tooth was non-vital because of, some sort of trauma or something else that went on, and then the root canal was done, you may have a little bit longer that you can get away with it, but I certainly wouldn't push it past, a few months, 3 or 4 months max. Anything longer than that, yeah, you're taking your chances.
Okay. And I'm sure some people out here needed that. All right. Someone asked about some of the best dental schools out here, and just wanted to get your opinion on that.
Dental school is, when I was in school, you see, it's a lot like pledging. They put you through hell, but when you get out, you're appreciative of what they put you through, and it creates a bond that will never be broken. Most dental schools, particularly in the United States, are all accredited. They all have to meet certain standards. So, I can't say one is better than the other. I certainly have to, shout out to the HBCUs, which are, Meharry Medical College and Howard University. For minorities, absolutely, they are the best. And what you get out of those schools is not something that you're necessarily going to get out of other places. However, There are other schools who do have large minority populations and who have done very well over the years in terms of recruiting minorities into the profession. University of Maryland, University of North Carolina, Chapel Hill, Tufts University, University of Detroit Mercy, all those schools have done excellent jobs in terms of recruiting African-American students. So, but one of the things that, certainly we're concerned with, and that is we're not recruiting enough African-American males into the profession, and that I'm sure that goes into medicine also, which is, for being a male, obviously that's an issue. Women in dentistry are great, and it's extremely important, but we need more men in order to create the role models for the future. And so we really need to try and encourage more to get involved in healthcare and to become, our future leaders.
I agree with you on that point, and definitely even in medicine, the same thing's happening. Okay. Are there specific toothbrushes and toothpaste that are better for cleaning and maintaining dental health?
That's an interesting question. Typically, as a dentist, we recommend that people utilize a soft toothbrush. One of the reasons for that is people tend to overdo things. So in other words, you're not trying to scrub your teeth till they're super smooth, because toothpaste itself tends to be abrasive. And then you add a brush to it and you're abrading away the natural surface of your teeth. So you want to be very careful in terms of that. And that's in terms of a manual toothbrush. There are electric toothbrushes out there. One of the things that people tend to do with electric toothbrushes is treat them like a manual toothbrush. So in other words, if you've got an electric toothbrush, you shouldn't be going back and forth and doing that at the same time, because now the toothbrush is not allowed to do what it was designed to do. Most of them are rotary or sonic. The rotary ones typically either go 360 degrees or go, oscillate back and forth 180 degrees. But what happens is when it does that and you put a little bit of pressure on the teeth, the bristles spread. And when the bristles spread, that's what ultimately removes the plaque. Now, remember, when you're brushing your teeth, if you have tartar, which is plaque, which is older than 24 hours, your toothbrush is not going to get that off. So, and in terms of toothpaste, it's really your choice. Toothpaste is a way of getting some extra fluoride to help remineralize your teeth. It is usually a mild abrasive to help remove the stains from your teeth, but it's just like, hey, if you've got a stain on the floor and you just pour soap on it and then rinse it off, it's not going to do anything. You've actually got to wipe it, clean it in order to make it move. So it's the same thing. But whatever toothpaste you like is fine. I don't have any objections to any of them. Any of the fluoridated ones, preferably. I know some people are anti-fluoride. The amount of fluoride that you're going to get, unless you're eating toothpaste, is not going to be of any damage to you. It's not going to hurt you. It's not going to give you any brain damage. It's not toxic.
Okay. But in a follow-up to brushing teeth, someone in the chat wrote, a person new to wearing braces, what's the best recommendation for brushing?
All right. Definitely brush after every meal. One of the issues when you have, especially if you've have brackets on your teeth, the problem is food and other kinds of things tend to stick to that. It becomes a rougher surface and it's more difficult to get to. So you've got to take your time. So yes, I would definitely recommend an electric toothbrush. They do make toothbrushes, electric toothbrush heads that actually are designed for people with orthodontic brackets on. The other thing is I would recommend would be a water pick or a water flosser. That will allow you to flush away some things in between your teeth and actually will help quite a bit. People who don't brush their teeth well, you take the braces off 2, 3, 4 years from now and you find out you've got all these cavities. That's not a good thing.
That's not a good thing at all. Okay, let's get one more here, Doc. Someone wants to know what's the difference between regular cleaning and scaling and root planning.
Okay, so here's where we start talking about treatment for periodontal disease. So what we're trying to do when we diagnose periodontal disease, we actually, number one, take x-rays. Number two, we probe your gums to find out just how deep the pockets are. And the pockets are that space between where your gum starts and down to approximately where the bone is. The magic number is 3 millimeters. Your toothbrush, floss, whatever you're using will go down about 3 millimeters underneath the gum line. So, if you were to have a ruler out there and you can see how much 3 millimeters is, it's not a lot. So anything greater than 3 millimeters is an issue. So any treatment that we do is, number one, trying to get those pockets to shrink back to 3 millimeters or less. Now, what happens is if you're not getting all the plaque off your teeth and it then becomes tartar, it does start to migrate underneath the gum line. As it migrates underneath the gum line, it starts to affect the bone. As I said, periodontal disease is an inflammatory disease. Your body tries to fight against inflammation in many different ways. So what happens is those toxins that are produced by the bacteria in the plaque cause not only the gums to swell, okay, which in turn makes the pocket deeper, but it will also over time affect the bone. The bone starts to shrink away. The body does not like inflammation. So the bone starts to shrink away or eat itself away, which in turn makes that pocket deeper. So the whole idea of scaling and root planing, scaling is to remove the hard deposits. Root planing is to try and make the roots as smooth as possible, so it's much more difficult for plaque to adhere to. An easy thought is, if you've got a wall, and for those of you who kind of know what a stucco wall is, it's one of those walls that's got, that bumpy paint on it and what have you, and then you've got a smooth wall. If you've got a smooth wall and you put some butter on it, how difficult is it to wipe that butter off of that smooth wall? And if you've got one that's a stucco wall that's bumpy and got a lot of little nooks and crannies in it, how difficult is it to wipe that, the butter off of that? So if you think of that, we're trying to make those teeth as smooth as possible, because once they're smooth, it's more difficult for plaque to adhere. The tissue then starts to heal and the inflammation goes away, and the tissue then moves back closer to the teeth and helps to protect the bone and the root surface.
Okay. All right. Can we get one last question?
Sure.
One last question here. Let's see. Mentioned, would you recommend over-the-counter mouth guards to prevent grinding teeth at night, or have one prescribed by our dentist?
But let's look at it this way. They advertise all these things and they have all these things at the sporting goods stores and other places in the drugstore. They can help to a certain point, but the ones that are made in a dental office are custom made and they're adjusted appropriately so as not to do any other damage. So, when we start buying stuff over the counter because it sounds good, we start, treating ourselves, and that's not necessarily the best thing. So first of all, you want to make sure you understand why it is that you're grinding your teeth and what the cause is, so we can get to the root cause and deal with that. You're treating the symptom, which is okay to a certain point, but if you're causing some other issues, you may need to find out what's going on. So I wouldn't recommend those over the counter ones. I would certainly recommend that you talk to your dentist, have a conversation with them about what's going on and try and get to the root cause of it. We've got a lot of new tools that help to figure out, what's going on and why it's going on. And by the way, grinding your teeth can also be caused by sleep apnea. Again, that's another way the body wakes itself up.
Brother Dr. Chappell, I really appreciate you coming on and sharing, giving us such good knowledge about oral health. I think it was very well received. And one of the things too, I want you to give us, you practice in the area. Where are you practicing?
Yeah, I'm over in Bowie. We're basically about 4 or 5 blocks away from Bowie Town Center. We're at 3060 Mitchellville Road on the first floor, Suite 107. We've been in that building since 2003. And yeah, we definitely accept new patients. And so we look forward to anybody, if you have any questions or what have you, definitely feel free to call our office. Our phone number is area code 301-390-9185. Again, 301-390-9185. And my website is yourbowieDentist.com. It's yourbowieDentist.com.
All right. And this is Brother Dr. Edward Chappell, who's former president of the National Dental Association. We really appreciate you and your time today. Thank you very much.
Yeah, thanks for having me. Appreciate it, bro.
Take care.